Okay, it's Dr. Buford. We're just getting started. We're going to plug the shaver in, so we'll show you how that spins around in just a second. But we're just getting started on the left shoulder. We're looking in from the back to the front. Everything that you see is magnified about 30 or 40 times on the screen. And we can see the biceps has already been tenodeced. We'll show you some more in just a second. I have to get one more thing organized. Okay, so here's our shaver. It's got suction attached to it. And we're just debriding a little bit of the labrum here, primarily just so we can see a little bit better. Lift up on the shoulder, please. As you look down the front of the shoulder, this anatomy looks pretty good. A little bit of labral fraying in the back of the shoulder here. And here we are just finishing up the work in the back. Now we'll look up at the rotator cuff area. And the rotator cuff area here looks pretty good on this side. A little bit of undersurface fraying right here. And we'll put a little stitch across just like we did a little bit earlier today. It's a very similar injury. We've had these injuries seem to come in threes. So we'll take a spinal needle, and then we'll take a shuttle relay. If you stay on the screen. So with the spinal needle, we just pass a needle just right there on the left side of that tear, which is the anterior side. We'll take a black wire that you're about to see come into the screen. Stay there. Keep me steady. And then I need a grasper. And once we grab it, we'll back the needle out. We'll load this with our suture. Drop it. Just okay, so now we're going to take the spinal needle through one more time. This time we're going to take it on the posterior side of that split right here. Here you go. And we're going to take the shuttle relay, that same black wire, pass that across again. There it is. And then we'll take the same grasper, and we'll go ahead and load this one more time. So this basically serves as a marker stitch. It lets us know exactly where this area is when we get to the other side of the tendon. Sometimes there's additional injury on the other side of the tendon, and we end up having to complete the tear and completely repair the rotator cuff down to the bone. Sometimes there's no injury on the other side, and we can just tie this as a ripstop stitch, and you'll do just fine. I just wanted to show you how we do that. Okay, so we're going to go off on the video now. Okay, so we're looking in the subacromial space. Remember, we were worried a bit about the rotator cuff. There's the marker sutures. And the good news is I really don't see any significant tearing in the rotator cuff on this side, so I think we can just tie those as kind of a stopgap, or ripstop really is better terminology. So we'll take a crochet hook, and we can grab those right here and tie them. But beyond that, I don't think we need to revise the decompression or anything else that's already been done. This all looks pretty good. I don't see any prominent anchors. I'm trying to look far lateral here. And as I do this and rotate your shoulder underneath the camera, this all looks pretty good. Okay, so we'll go ahead and tie the sutures, show you some more in a minute. Switch positions with me. Okay, so we've tied that little ripstop stitch since there's no reason to waste it. And the rotator cuff here looks pretty good. So we're going to finish up here and have a look at that biceps tenodesis next. This will be the end of the video because the biceps tenodesis part is outside the joint. So hopefully what we're about to do will give you some relief, and I can reassure you that what we saw inside the joint and in the subacromial space here was not concerning. Okay, bye-bye.